Up next on The Reveal. Battling the COVID pandemic. What's really happening inside our hospitals? A view from the front lines.
And she died the next day after the last words out of her mouth was just, "Whatever you do, please don't let me die."
Help is on the way. But what about public confidence?
People were really skeptical about how a vaccine could be made so fast.
You're having to work with your phone.
And covering the COVID crisis on college campus.
Is it harder, easier to get information?
From our Midtown studios in Atlanta, The Reveal begins now with our multi-Emmy and National Mural Award-winning team of investigators.
Welcome to The Reveal. I'm investigator Rebecca Lindstrom. I first met pulmonary critical care physician Jennifer Barbary in September to get a frontline perspective of how hospitals were handling COVID. We talked about compassion fatigue, the importance of wearing a mask, and the heartache she felt every time she lost a patient. 3 months later, the situation is only worse, with nearly a third of all patients in North Georgia now being treated for COVID.
Tired, concerned,
One word or phrase.
grief.
That's what I asked these medical professionals to write down.
You hear more discussions amongst healthcare workers about the level of fatigue. They're being asked to do more because it's necessary. We need shifts covered.
How many of these words do you relate to?
I think all of them.
Numb.
I know that person well, and he has been in the COVID-19 unit voluntarily since March, serving faithfully. There's some really good things about some of these words. Or teamwork, for example. There is more team mentality now than we've ever had. It takes a team to take care of these patients. I think if more people could really understand what these people are doing every day, they would realize we need help. We are giving 110% each and every day, and I think most healthcare workers would say they need everyone else to do the same.
And what does 110% mean?
Wearing your mask, whether you like it or not, social distancing, washing your hands, and avoiding large gatherings. I think that's crucial right now.
What was your word?
Discouraged. I had a lady just a few days ago that needed to be intubated, and she said, "Can I call my husband, before we do this?" And she had lost her mother to COVID just a few days prior in the same hospital. And she died the next day after the last words out of her mouth was just, "Whatever you do, please don't let me die." And that plays over and over again. And I know the victories are out there, and I think we are sending more people home, but it's the sheer volume right now that is just so discouraging. It's just hard.
Of all these words, the only one I see on here twice is hope. Where does hope fit into this?
I'm putting my hope in the vaccine. I'm praying that that's my Christmas present. That'd be the best Christmas present I could get right now.
To get the vaccine?
Yes.
Healthcare workers are first on the list to receive the vaccine, along with nursing home residents. Some medical professionals, though, have expressed concerns, wanting to learn more about the science. Others, though, rolled up their sleeve before they ever even knew if the vaccine would work.
We're going to have a vaccine very soon.
A number of the clinical trials are ongoing.
It would certainly not be for this year.
Process of rigorous reviews.
The time you mobilize.
It has been months of mixed messages and bouncing timelines for a COVID vaccine. But Kevin Cleary says block out the noise. Focus on the science.
You trust a plane to fly? That's science behind that.
Cleary is an emergency room doctor with Piedmont Healthcare. Work is a daily reminder COVID remains a problem.
The intensity level has just kind of doubled, tripled.
Healthcare workers will be among the first to receive the COVID vaccine, but hundreds may already be immune. That's because doctors like Cleary volunteered for phase 3 trials.
We have had people from Piedmont health system come from throughout the state, and that has been uplifting.
Dr. Nathan Siegel is the lead investigator on 2 of the COVID vaccine trials at Clinical Research Atlanta. The lab has about 800 people enrolled in trials for Moderna and Pfizer, and soon it will start a trial for a 3rd vaccine, Novavax. Georgia is playing a key role in the process, with all 5 FDA-approved stage 3 vaccines being tested in the state. Ashley Neely is part of the Pfizer trial through another lab in Atlanta.
The total commitment is up to 2 years.
Neither of these participants know if they received a placebo or the real thing, but they both had side effects that lasted about 24 hours.
Feels like you got punched in the arm, kind of not by your best friend.
I wasn't expecting to feel that tired, so I was really fatigued.
They are normal side effects that usually fade in a day and important for people to expect when getting the vaccine.
I think that's something that we need to communicate about. That's to be expected. It's not a complication. It's not a problem that needs to be worried about.
The state's top health official, Dr. Kathleen Toomey, plans to talk a lot about vaccines in the coming weeks. She wants people to feel confident not only in the science, but also the distribution process.
Because until we can vaccinate as many Georgians as possible, we will not have the level of immunity within the state as a whole to prevent continued spread.
Before the Moderna and Pfizer vaccines went to the FDA for approval, 70,000 volunteers spent months tracking how they felt on a phone app.
Yeah, this is the app.
There were several in-person visits to give blood and analyze the vaccine's impact. And there were 2 COVID tests, the nasal swabs that make many people cringe. It is a 2-year commitment, so there are more check-ins to come. But participants say the process is worth it.
I would do it 100 times over, for sure.
Part of the confusion over the vaccine timeline was that some of the people involved in the study had to actually get sick to determine if it worked. And no one could predict when that was going to happen.
If you have any symptoms whatsoever.
For emergency authorization, the vaccine had to be at least 50% effective. So Moderna, for example, needed 151 participants to get sick. The hope was that all 151 people with COVID received the placebo. If more than 37 of them got the vaccine, it wouldn't be good enough. But both Moderna and Pfizer vaccines proved far better than that. After the 2 shots, given 3 to 4 weeks apart, they report the same effectiveness, about 95%. With nearly 300,000 COVID-related deaths across the country by early December, more than 9,000 of them here in Georgia. Neely believes the vaccine offers hope.
The more people are able to share their stories, I think more people will be inclined to get it.
Dr. Cleary already fights to save lives in this emergency room.
You have no idea what.
He believes getting the vaccine may also help save his own.
For me, it's just another added layer of protection. Why take a chance, honestly?
Good to see you. Clinical Research Atlanta says about 20% of the people involved in its Moderna study are healthcare workers.
Coming up on The Reveal.
If you intervene early, get people into quarantine, then it stops spread.
We examine how that strategy is paying off for one Georgia university.
Welcome back to The Reveal. Many Georgia public schools and universities ended up in the national spotlight when students started to return for in-person learning. Crowded hallways and late-night parties caused COVID cases to spike. But Georgia Tech also showed us that testing and a belief it matters could also make a difference. Once a week, every week. That is the push at Georgia Tech.
It's important because ethically speaking, this only works if everyone does it.
The call to action is hard to ignore.
I get constant text messages and emails.
There's a sign for COVID testing plastered on just about every door and along the sidewalks you pass to get there.
And I was just of the mindset that if we didn't test as many people as possible, that this thing would just keep growing somewhat exponentially.
Greg Gibson, a professor of biological sciences, created Georgia Tech's testing model. He made it simple. A saliva test, not a nose swab, an app to register, and testing sites scattered across campus. The university added treats, cookies, popsicles, and they aimed high. 1,500 asymptomatic tests per day. Have you been meeting that goal?
Yeah, so I kind of laughed at the leadership when they said that was our goal, said there's no way we'd meet that.
But they have met that goal, at least on average. Heading into December, Georgia Tech had conducted more than 146,000 COVID-19 tests. That is 5 times as many as UGA, which set a goal of 24,000 tests by Thanksgiving. Gibson believes Tech's testing program has helped cut COVID cases on campus in half.
If you intervene early, get people into quarantine, then it stops spread.
Gibson compares it to a game of whack-a-mole, and it's paying off. Tech reported 1,300 COVID-positive students and staff, but that's compared to 4,100 at UGA.
I honestly thought they were going to cancel the semester on campus.
Tech had 679 cases in its first 2 weeks of classes. Internal emails obtained by the Reveal expressed frustration with the large crowds gathering at Greek houses and students packing into midtown bars. It was so bad, Heidi left for a few weeks to live at home.
A lot of people our age are asymptomatic, so they could have it and spread it to people without even knowing.
Her sorority now requires weekly testing.
It took a lot of people just to see the numbers to really understand, how their actions can have consequences.
Talk about getting the message. Tech had more cases in those first 2 weeks as it did in the next 2 months. Students credit creating a culture of responsibility.
We're all in this together kind of approach. Jackets protect jackets.
Now the message is jackets protect family. Students were urged to get a COVID test before heading home for the holidays. And that's how we met Alex and Heidi.
I just want to make sure I don't give it to my parents or my grandparents.
That could mean somebody's life, somebody's dad, granddad, brother, sister.
Like the community that surrounds the campus, there are students who aren't worried about COVID and have yet to take a single test.
And that's why we're always going to have cases.
But students say their numbers are proof what can happen on campus and even in metro Atlanta if enough people buy in.
A third of the campus is testing weekly, which is absolutely remarkable. I wouldn't have predicted that.
UGA started holding pop-up testing sites and giving away freebies to encourage testing. Throughout the semester, journalism students found themselves covering the virus's impact as well as living it. So how has campus life been different this year? Reporters like to ask questions, not answer them. But as I listened to these 2 students, I learned whether you've been reporting for 2 decades or 2 years, COVID's impact on journalism is much the same.
You're still turning stories. You're having to work with your phone and a ring light instead of a nice camera.
Jillian Tracy expected to spend her last year working in UGA's busy newsroom at the Grady College of Journalism, rotating through the various positions from anchor to assignment desk. Like 11 Alive Studios, access is limited. Reporters work from home, or in this case, their dorm. Is it harder, easier to get information?
I think it's easier. I think people want to be heard.
But I think the mentality is kind of we're all going through this, so there's no hierarchy of there's not someone I can't reach, because you know that more than likely they are probably working from home in sweatpants.
Daniel Harvey admits COVID taught her important lessons on bias, even her own.
The University of Georgia on-campus testing site now has 500 slots for appointments each day.
I think that I'm very passionate about testing being mandatory, but my professor just drills into me, just the facts, not any other outside opinions or things like that.
In the fall, more than 8,000 students returned to live on campus. Thousands more arrived each day to walk the halls for labs and hybrid classes, giving COVID a new path to spread. Jillian says the administration should have anticipated the parties, even if it couldn't foresee the unintended consequences of virtual learning.
First and 20. The ability to go to an SEC football game and live the tailgate is a big appeal for a lot of students, and I think people have been using the ability of virtual classes to say, hey, let's go somewhere else for a week.
But for those trying to follow the rules and be responsible, there's a feeling of isolation, even for these reporters covering the community.
Virtual classes sound like a great idea, but when you're staring at your computer screen for 6 to 8 hours a day, all you want to do is walk across campus and have 10 minutes to keep your eyes off of technology.
You need that human connection. Sometimes I would just look around in my room for like something to wash, like a throw pillow, just so that I can do laundry and see that there are other people around.
The mental health crisis created by isolation. Maybe that too is a story.
Up next, the pandemic's impact on seeking justice in Georgia courts.
Do you have concern about the length of time that it's taking? Innocent until proven guilty doesn't mean free until trial. COVID has convicted thousands to a lengthy jail sentence as courts try to figure out how to hold jury trials without spreading the virus. Ending their legal limbo may soon be up to you. David Worth has been behind bars for nearly 4 years, determined to clear his name. But just days before his trial was finally set to start, the courts in Gwinnett and across the state were ordered to close. David's parents understand why. Both are medical professionals.
They wanted Brian to appear by basically Zoom.
Because they didn't want me to be in there as a first responder, directly every day exposed to COVID patients.
With the trial on hold, David's attorney asked to have the charges dropped, or at least to grant bond. But the DA's office said David's only option was probation after his guilty plea.
Well, that would only escalate things and push him into a prison situation for a crime he didn't commit.
David is accused of using the dark web to send a letter to a former teacher threatening to kill her. It is just one of nearly 1,600 active cases Gwinnett County reported in November, still trying to make its way through the court system. And that doesn't count the nearly 900 cases at the time that were waiting for a grand jury to indict. Do you have concern about the length of time that it's taking?
Sure, that's an absolute concern. Each one of those cases that is in the backlog represents some real meaningful questions that impact lives that need to be resolved.
Chief Justice Harold Melton has led the Judicial COVID-19 Task Force. The state's original pandemic plan prepared for a 90-day shutdown.
We're well past that. May it please the court.
While most court proceedings moved online, anything requiring a jury trial has remained on hold, and Metro counties say it will likely stay that way, at least until January.
I can't say enough about how important it is that we get started back, that we find a way to do this during the pandemic.
Courts have started to submit plans for how to do it. Judge Jeffrey Bagley says Forsyth will only hold one criminal jury trial at a time. An architect has offered ways to transform this large room into a court, and they're debating how close jurors should sit, even with plexiglass between them. The court will pass out transparent masks so that the jurors can better understand what's being said and how it's being said. And some trial participants may get a rapid test each day.
If the defendant tests negative, the defense attorney tests negative, they can both be sitting at counsel table together and communicating as they normally would.
In Jackson County, witnesses can testify from where they're seated instead of taking the stand. Hall County plans to hold a pilot trial to learn what works best before setting its court calendar. Safety is key because all of this hinges on jurors showing up.
You're asking the citizens of the state to get up off their couch and come to a building, and you're not really asking them, you're telling them that they must come.
David's family thought by now he would be home, making the past 7 months even harder.
Oh, here's David.
David is able to make calls, and they schedule several video chats a day.
My last bill from Securus Tech was $260-something, and that's per week.
Several of the pandemic plans openly admit it could take years to clear the backlog in cases.
Everyone is essentially sitting waiting on a non-existent court date.
David feels some people are taking pleas just to get out of jail.
I feel like it is a coercion tactic.
But Chief Justice Melton says that frustration goes both ways.
I know the state probably feels like they're being asked to provide some options that they otherwise wouldn't put on the table, but we don't want COVID to be leveraged.
Gwinnett's inmate population started falling in March. More lenient bond restrictions and plea deals likely helped. The DA's office says it has worked to resolve more than 1,500 cases without a jury trial. But it is unclear how many of those defendants were behind bars.
We love you, baby. I love you so much.
The Wars say none of that has helped their son, or the teacher who wants peace of mind that the person who sent the letter is held accountable. For that, they will both have to wait. For that, they need a jury. According to the Bureau of Justice Statistics, nearly a third of all felony trials do not end with a conviction. While most counties hope to resume jury trials in January, at least one federal district court has suspended them until March, and more delays are likely to follow if cases continue to rise. If you have a story you'd like us to investigate, email us at thereveal@11alive.com. And thank you for joining us for this special edition of The Reveal.